So the results are that these patients who are managed by the coach program, they had a drop in their hemoglobin A1C. The average A1C at entrance was over 10%, and they dropped by about 1.7 to 1.8%. And they had fewer visits to the hospital, fewer visits to the emergency room. When they were admitted to the hospital, they had shorter hospital stay. More of them were using diabetes technology. And so we think it's a combination of factors, including better adherence to medication, understanding the disease better, and the coaches helping them with these unfavorable social determinants of health, which is the hardest part to quantify. I can quantify the days in the hospital. I can quantify the total. They also had lower total medical expenditure by about $2,600 a year. And this is hard figures because we took our ACO population. So it's easy to quantify those numbers, harder to quantify how did we do with their mental health, how did we do with getting them housing, how did we do with getting them the medications cheaper. But this is the kind of stuff that the coaches helped with, which is beyond the traditional role of the AmCare pharmacist, right? And how the coaches do this is, and we learned this as we did it, actually. We didn't expect this. So the program started out with very traditional models, talking to the patient about the medications, how they work. If they were unaffordable, the coaches being pharmacists were able to get them on a patient assistance program or find a cheaper brand or generic alternative. But then the coaches realized that these patients were struggling with other things. And we know that half of the diabetes outcome, more than half, depends on social determinants of health. Diabetes affects people with unfavorable social determinants of health. And their outcomes depend on how we handle these issues. So the coaches quickly learned that these people had problems with housing, transportation, financial difficulties. And then in the Worcester area, central Massachusetts, they developed networks and they figured out where to send these patients if they're having these problems. And so that is what helped. The other thing that really helped is forming that relationship. Patients feel connected to someone. They can share their problems. When they come to a medical provider, it's a 30-minute visit at the max. And there are so many things to discuss that they're not really comfortable discussing their financial issues, their food insecurities, their housing issues. And so when you're talking to the coach every week or every other week, these things come out, and then the coaches were able to help them.
Yeah, I mean, completely agree with Samir that every patient is unique, and that I think what's great about the program is that we've tried to give the coaches the bandwidth to really tailor the care program, to listen to what because the first step is always getting the story from the provider. What has been your experience with this patient? What's the care plan right now? How can we supplement that now that we have an extra set of hands on deck, here with like a pharmacist skill set? So I would say, Brianna, if you're asking us kind of what, out of that menu of services, what do a lot of patients tend to need? I mean, certainly like nutrition and lifestyle, it's diabetes. So, that we're, always talking hand in hand with the medication about their diet, about, looking at their CGM trends, asking them kind of like what their, what sort of like lifestyle, sort of tendencies have led to the particular trend we're seeing on a Dexcom or a Libre, and then trying to get at that. And then obviously motivation is that's, keeping folks motivated in diabetes care, is an ongoing challenge. It's an exhausting disease. So, and you want to talk about something that's really unique to every patient. Absolutely. Like what motivates all of us? It's extremely unique to every patient. So I think to Samir's point, letting these coaches get to know these patients so well that they understand those motivators. They can get a better sense of what their life is really like, family structure, kind of, job, work. And they end up, the patients end up disclosing a fair amount, and that really can help structure sort of like almost like a bit of a motivational plan so that they stick with the routine that's being advised.